Hi, welcome everyone. I'm so glad you're here today, and I hope this recording behaves itself because technology really has a way of keeping us on our toes. Before we begin, I want to say on behalf of the Horizon Benefit Services team, a heartfelt thank you to all of our wonderful friends and clients. Everything we do at Horizon Benefit Services happens because of you. Our business is built entirely on referrals, and we're deeply grateful for your trust and support. You make what we do meaningful in so many ways. And if we're friends on Facebook, you'll know I love my morning walks. And I wish I could say I took this photo I'm showing today, but next year I will. A big shout out to our insurance company partners, starting with United Healthcare, our platinum sponsor, and Blue Cross Blue Shield and Humana as gold sponsors. Their generosity helps us host fun client events like pizza nights and comedy shows as a small token of our appreciation. These companies specifically recognize the great work that we're doing in the community and for our clients and want to support us. So thank you to them. Next, do you have us as a contact? I sure hope so, but if you don't, now's a great opportunity to make sure that you have us saved in your cell phone. Save both the work phone number and the work cell number. And the reason why we say the cell number is because we're going to be sending text messages out throughout the year. This time of year, Medicare scams ramp up. You probably already know this. You might get messages claiming that your coverage isn't going to be valid in 2026, and 90% of the time, those messages are absolutely false. If something sounds suspicious, please ignore it unless it comes from us directly. But that's why having us saved is so important so that you know it is coming from us. And with that, I'm proud to introduce you to the 2025 Horizon Benefit Services team. As you know, our heart and our mission is to revolutionize the experience of shopping for insurance by providing clarity and ease to the process. We believe in empowering our clients to know how to choose and use their benefits. And we're so glad that you're here because that speaks to what you want to do for yourself as well. So, starting with the right side of the screen, I'm proud to introduce Lori Olmstead. Lori is new to the team, supporting our small business and employee benefits clients. And we've got Phyllis Bonteg, and Phyllis has decades of experience in the insurance industry, having worked for Ann Hewitt and also as a ship counselor. Then we've got me in the middle. You know me already. And Ruthie Hanson to the left. She's a friendly voice who often greets you when you call. She's newly licensed and will be helping with Medicare supplement and Medicare Advantage reviews and enrollments. And on the far left, we've got our newest team member, Lillian Rodriguez. Lillian is eager to learn and excited to help our clients. I couldn't be prouder of this team and their shared passion for serving our clients and the community. Let's talk about ANOC shock. And if you've not heard of it, it's really not an official condition, but it's something that can be easily prevented. So, this time of year, every fall, you receive in the mail or electronically an annual notice of changes document for your Medicare Advantage Part C or your prescription drug plan Part D. Please, please, please read it carefully as this outlines upcoming changes for the next year. It never fails that we have clients who don't pay attention to this, don't ask us for help with looking at plans for 2026. And then they call us in January because their prescription drug plan premium jumped from $20 to $90, or maybe even more, or their Medicare Advantage plan dropped some benefits or reduced benefits, and they weren't expecting that. So, again, these changes are easily identified in the annual notice of changes, and staying informed helps you avoid these icky surprises. As we get into today's presentation, I want to have a brief refresher on the different ways to get your Medicare. Medicare was never intended to pay 100% of your medical bills. It was created as an offset for your medical expenses by providing a basic foundation of benefits. It does cover a lot, but there's deductibles, co-payments, and co-insurance that aren't covered. And our goal is to help you know which options are available to you to mitigate that and to pick the plan that's going to best meet your needs and budget. So, the two primary choices on the left, you can keep your original Medicare, your red, white, and blue Medicare, the Medicare with the deductibles, copayments, and coinsurance, and you can add a Medicare supplement plan, also called Medigap, to fill the gaps. Because prescription drug coverage is standalone, you'll want to add a Medicare Part D plan if you go that route. The other option is to go with a Medicare Advantage plan or Medicare Part C. And those plans are typically HMOs or PPOs. With a Medicare Advantage plan, an insurance company manages your A, B, and your D benefits in one plan. And it often includes additional benefits like dental, vision, and hearing. I remember when I was a kid learning algebra with my grandpa and X's and Y's, and he would say it's like apples and oranges, Carrie. And that's what I want to say here. These are just two very different options, and neither is better. It's truly about finding the plan that's going to best fit your needs and your budget. On this next slide, we go into a little bit greater depth on the differences between Medicare Supplement and Medicare Advantage plans. So when it comes to doctors and hospitals, with a supplement plan, you can go to any doctor or hospital that accepts Medicare patients. With a Medicare Advantage plan, you may have a network of doctors that you need to stay within. When it comes to referrals, you can see specialists with a Medicare supplement without any referrals. With Medicare Advantage, if you have a PPO, you can see specialists without referrals. If you have an HMO, you're likely going to need a referral from your primary care doctor in order to see a specialist. When it comes to networks, with Medicare supplement plans, coverage goes with you across the United States. With Medicare Advantage plans, again, it's going to depend on whether you have HMO or PPO. Emergency care for sure is covered for travel within the United States and even sometimes abroad. But you're going to have a network of doctors and hospitals that with an HMO, you have to stay in network. With a PPO, you probably want to for a reduced cost share. When you're first turning 65, you have the option to do anything you want to do, Medicare Supplement or Medicare Advantage. With a Medicare Supplement plan, they don't ask you any medical questions. However, if after 6 months or a year or 10 years, you decide you want to change from one Medicare supplement insurance plan to another, you can be asked medical questions that determine your eligibility and your rate. With Medicare Advantage plans, you can generally change plans every year during the annual enrollment period or first part of the year during the open enrollment period. Medicare Advantage plans never ask medical questions. It's very easy to go from a supplement to an advantage. Going from an advantage plan to a supplement means that you might be asked medical questions that will then determine your eligibility and your rate for that Medicare supplement plan. When it comes to costs, looking at Medicare supplement plans, you generally pay a monthly plan premium in addition to your Part B, and when you use your services, your out-of-pocket costs are limited. With a Medicare Advantage plan, you really just usually pay a low or $0 monthly plan premium in addition to your Part B. When you use services, however, you do pay as you go. You have deductibles, copayments, coinsurance, etc. And I just want to emphasize for a moment, either option, you're paying your Medicare Part B premium still. When it comes to prescription drug coverage, original Medicare with a supplement plan, you do want to consider purchasing a standalone Part D plan. With a Medicare Advantage plan, prescription drug coverage is likely going to be included. On occasion, we do have someone who's using the VA for their medicine, and they just want a Medicare Advantage plan only, but most plans are Medicare Advantage prescription drug plans. So pop quiz, true or false? During the Medicare Annual Enrollment Period, I can change from one Medicare supplement plan to another without having to answer medical questions. I'm going to give you a minute to think about that. It was interesting when we polled our live audience during some of our in-person events, we got answers on both sides of the true or false. But I'm here to clarify and to tell you that that answer is false. Medicare Advantage plans are guaranteed issue. Medicare supplement plans, however, are state regulated and usually require medical underwriting if you switch later. That's super important to know. And as we're going to talk about some of the Part D and Part C changes, because that's really what the annual enrollment period is about, I want to talk about how plans are created. Starting with CMS. CMS stands for the Center for Medicare and Medicaid Services, and CMS sets rules for all plans. They give the insurance companies design options with which or parameters where plans are designed within the parameters and then they submit them for approval. Once the insurance company's plans are approved, then beneficiaries have the option to choose from those plans for their enrollment decision. Think of it kind of like CMS saying the porridge can't be too hot or the porridge can't be too cold, and all plans must fit just right within their guidelines. And the guidelines, again, are guidelines, but there's some flexibility within that. And we're going to talk about that here with the Medicare Part D prescription drug plan conversation. We're starting with the 2025 Medicare prescription drug plan design. And as you look at this, I want you to notice that there are three coverage stages. There's a deductible of $590 this year. After the deductible, then you pay copays or coinsurance up to $2,000. And then after that, you go into the catastrophic coverage phase where you pay nothing, but not quite yet. Let me just point out a couple things. There's this beautiful F word called a formulary. And a formulary is a list of drugs that are covered by your plan. It's super important that you make sure your medications are on your plan's formulary. Otherwise, they won't count towards that out of pocket limit. Also, using drug programs like GoodRx or importing drugs from Canada does not apply towards that maximum out of pocket of $2,000 either. You'll notice that there's a missing piece in this Medicare drug plan design, a good missing piece, quite honest. And that's called the Medicare prescription drug plan donut hole. Yes, the infamous donut hole. Under the Inflation Reduction Act, passed in 2022, the donut hole has disappeared. Okay, but know that with these cost changes, the 2,000 cap, the donut hole disappearing, the money doesn't go away, it does shift. And there was this premium stabilization demonstration introduced last year to prevent the drug plan premium from increasing too much because of that. All right, let's talk about 2026 Medicare Part D changes. And can you guess which direction the deductible went? Yes, if you guessed it went up, you're absolutely right. So for 2026, the Medicare prescription drug plan deductible is $615. The initial coverage stage is where you pay copays or coinsurance up to a maximum out of pocket of $2,100. When we were doing these live, a question came up and said, well, how do I know how this works for me? And here's what I'll say to that. These are the parameters that the government sets. Some plans cover generic drugs before the deductible, so tier 1 or tier 2 drugs. And the only time you pay the deductible is if you get into a brand or a higher tier drug. Some plans have a higher monthly premium and no drug plan deductible. Some plans yet have all drugs subject to the deductible, and that's why that annual review is so important, so that you know where you're at in terms of your budget for the coming year. The other thing I want to point out is that you get an explanation of benefits from your insurance company every year that will, every time you fill your prescription, that will tell you here's where you're at with regards to the deductible, here's where you're at with regard to your maximum out of pocket. And again, please remember the drug must be on the formulary and you must not be importing it from another source. It must, or using GoodRx for a discount. Now, you might remember last year the M3P program, MPPP, was introduced, and that was to smooth the cost of Medicare out-of-pocket prescription drug costs over 12 months or 11 months instead of Some folks really getting hit January and February with very, very high out of pocket costs. That's called smoothing. And one of the clients jokingly said, smoothing is like Botox. Well, kind of, I guess, only it applies to your Medicare prescription drug plan. And it's super important that you consider your Medicare Part D plan and whether you should change it every year because you don't want to get duped. Every year, the drug plan formularies can change. In addition to that, preferred pharmacies may change. Preferred pharmacies typically offer preferred pricing. Plans may be discontinued. In this case, we already know that the Blue Cross Choice Plan is being discontinued. Sometimes when a plan is discontinued, you're crosswalked over to another plan that the formulary most closely matches your current plan formulary with the same insurance company. That just means that they're walking you into a new plan, but not based on price, based on coverage. So you want to pay attention to that. But this year, like I said, we found out that the Blue Choice plan is being discontinued. And so we're sending out notices to all of our clients who are affected so that we can help them pick a new plan for 2026. And sometimes new plans are available. So that's the other thing that we want to be thoughtful and cognizant about. All right, now let's talk about Medicare Advantage, Medicare Part C, and the plan updates that we're seeing coming for 2026. Just as a matter of setting some perspective, I want to share that starting in July, licensed agents like myself and Ruthie undergo training to learn about Medicare and about plan updates for the upcoming year. And while we're not going to talk about any specific insurance company or plan, here's generally what we're seeing for 2026. We're seeing some plans raising their maximum out-of-pocket limits on Medicare Advantage. So instead of a $3,000 or $4,000 maximum out-of-pocket, it might be 5 or 6. We're also seeing some network changes. For example, we know that Aetna Medicare Advantage and Blue Cross Medicare Advantage will be out of network with Endeavor Health, formerly known as North Shore, in 2026. Now, I'm not saying that they're never, ever, ever getting back together, but I am saying that for 2026, they're definitely not together. Sorry, I couldn't help but have a little jokey joke in there. And then there's new prescription drug deductibles on Medicare Advantage plans on the higher tiered medications. So we haven't always seen deductibles on Medicare Advantage plans. Some plans have a small deductible on medical. Some plans are introducing a deductible on the drug coverage inside of the Medicare Advantage plan for tiers 3 and above. Um, some plans are reducing their supplemental benefits. Instead of $5,000 in dental, maybe you're only getting $3,000 in dental, right? Or maybe your over-the-counter benefit is going from 75 to 50. Again, this is why that annual notice of change is so important. And then just like we talked about with the standalone prescription drug coverage, with Medicare Advantage plans, the drug plan formulary will also look at changes for the upcoming year. So please, please, please pay attention. And we don't want to find out that a drug's not covered once it's too late. And the other thing I want to talk about is indirect steering by the insurance companies by making certain plans non-commissionable. Ironically, here's what that means. It means that they don't want us enrolling you in plans, or they're thinking we aren't going to present plans that are non-commissionable to us. Full disclosure, I absolutely always will because I believe in transparency. Um, but if you were to call the insurance company and enroll through them, their internal sales staff would still get paid a commission. It's just on the external sales force or people like me who are helping you because they know that that's where most people enroll in their Medicare. All right. So let's talk about shopping Medicare Advantage plans and why you want to do that in 2026. Plan premiums can change, and those premiums are going to predict your monthly and annual costs. The provider networks, which we already talked about, are changing in some cases, and drug plan formularies. You always want to check and make sure that your prescriptions are covered. Out-of-pocket maximums can change, as well as the extra benefits. So, in final thoughts, before we get into some general Medicare changes that I want to share with you, You always want to consider, is your current coverage meeting your needs? Do you already know that your doctors aren't going to be a network for the upcoming year? Do you know that now in 2025? Is your current coverage limiting access to providers or services? It might be time for a change. If you're on a Medicare supplement plan and you want to try a Medicare Advantage plan, you have a 12-month trial right. If you're dissatisfied with a Medicare Advantage plan before that 12-month period is over, you can switch back to original Medicare and buy a Medicare supplement insurance plan, also known as Medigap, without underwriting. And spoiler alert, there's always one Medicare supplement plan that does not ask medical questions, and you can get covered as soon as January 2026. Oops, I said 25 on here, but that's should be 26. And I just want to highlight that's true in Illinois only. So watch for your annual notice of changes. The Inflation Reduction Act could mean shifts to your plan coverage, and it's more important than ever to review your ANOC, your annual notice of changes, before making your plan decision for 2026. The annual enrollment period is October 15th to December 7th. Now let's talk about some changes that were going to be coming to Medicare, coming to a town near you or a theater near you. And this, since I started presenting, I left this in because some of our first in-person events included information about this. There has since been a stay put on this about a week and a half ago. So I still want everyone to have some insight as to what the government is looking at doing with regards to original Medicare. And there was this WISER model being introduced. WISER stands for Wasteful and Inappropriate Service Reduction. And the WISER model aims to reduce unnecessary Medicare spending by implementing technology enhanced prior authorization processes for select services from 2026 to 2031. It was a voluntary program um, that was introduced. There were 6 states and 17 service categories impacted. And I want to be very, very intentional. This does not mean that benefits or services wouldn't be covered. It means that prior authorization would be required. And you can see here the 6 states that are affected: New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. And next, we're going to look at the services that were being impacted. So, some examples of services that could have required prior authorization were electrical nerve stimulators, vagus nerve stimulators, epidural steroid injections for pain management, incontinence control devices, and you see some non-healing wound services. So these are all of the procedure codes that you see listed. And again, it's not saying that they're not going to be covered. The intent is to verify medical necessity, not to deny care. But I want to encourage you to always ask questions if something doesn't seem right. And here's why. I had a client in my office about a month ago, and anybody who has Medicare supplement, you know that the prices, we went through some market repricing and stabilization this year, and Medicare supplement prices increased more than what they have in recent years. So I had a client wanting to shop, and while she's there, I said, "Is there anything else I can help you with today?" And she says, "Well, yeah, actually." She says, "I was told by my doctor that I had to go through um, physical therapy and injections before I could have a knee replacement." And I thought to myself, boy, is that interesting. So let me find out, right? I mean, inquiring minds want to know. Thankfully, I have a lot of people around me who do a lot of things in medical. So I phoned a friend and I said, "Hey, listen, my girlfriend manages an orthopedic practice." And I said, "Have you heard anything about Medicare making a change and requiring what's called step therapy, less invasive therapy before a big procedure for knee replacement?" And she says, "I don't know. She goes, "I haven't heard anything, but let me look into it and just see and make sure I'm not missing something, because, we all know this stuff changes." And she came back and she says, "No, Carrie, there's not been any changes with that." So I asked my client who was the doctor that was telling her this. And I called that doctor's practice and I asked to speak to the biller. And I said, "Hi, my name is Carrie. I serve a lot of Medicare beneficiaries in the area, and I have a client who was told this. Is it true?" And she says, that's a really great question. Let me just verify that nothing's changed before I give you an answer. So she comes back and she says, yeah, no, she goes, that's not at all required. And I said, well, interestingly enough, it was one of your doctors that told my client this. So I'd like for my client to get on the call with her, and let's see how we get this miscommunication resolved. And I look at that kind of like I look at these prior authorization rules, and my goodness, doctors are can be really amazing. Doctors also get paid based on the number of services they provide. I would hate to think that anybody is not working in a patient's best interest, but if I'm being honest, we all know that happens. That happens in every industry, right? I'm not picking on doctors, but my hope was with that exercise that we were able to resolve any misunderstandings or miscommunications, and that the biller was aware that the doctor was misinforming the patients. So just as we're closing up this conversation on the wiser model, know that there should be, I should say, checks and balances, because sometimes people don't always do the right thing. And again, I hope that's not the case. I'm surely not making that accusation, um, but that's kind of the why behind this. All right, now I'm going to talk about the big hot topic that can't tell you how many calls I got this year about this, but talking about GLP-1s. And this was under the prior administration. It was written as part of some legislation that GLP-1s would be covered for weight loss, and the final rule was never finalized. So you can see that um, CMS releases 2026 Medicare Advantage policy and technical rule declines to finalize coverage of GLP-1s. Now, GLP-1s are the Ozempic, right? The Wegovy, the medications that our society is commonly using for weight loss. So, what I want to say is that GLP 1s absolutely can be covered, but typically only when there's an underlying medical condition like diabetes or sleep apnea. But right now, the neither Medicare nor the state Medicaid programs are covering GLP-1s that are prescribed solely for the purpose of weight loss. And as any administration does, our prior administration undid the first Trump administration, some of their rules. They did their own rules, and now Trump is undoing some of theirs. I'm an equal opportunity offender when it comes to politics and our healthcare, because I don't specifically like it. But I do hear that future rules are in discussion. As of right now, though, weight loss coverage isn't included. Next, I want to talk about Cigna and Blue Cross merger news. So, as of July 2025, Cigna rebranded as HealthSpring. HealthSpring was acquired by HCSC Healthcare Service Corporation, which is the parent company of Blue Cross Blue Shield of Illinois, New Mexico, Oklahoma, Texas, and Montana. So as not to confuse you, here's what I want your takeaway to be. I want you to know that Blue Cross is franchised, and HCSC manages 5 Blue Cross states. They have acquired HealthSpring to introduce a national Medicare supplement plan. Um, I'm not one to go out and try new things with my clients. I'm not seeing their rates be like so much lower that it makes sense to really look closely at them yet. And as your trusted advisor, we're going to monitor how this affects plan options before we ever recommend changes. And again, this is affecting primarily Medicare supplement plans. Okay, so next I want to talk about our Medicare annual review process and kind of where we were, where we are, and where we're going. So, where we were was, you might recall last year in late August, early September, once we already started having conversations with our clients, WellCare, in addition to some other carriers, announced that they were not paying broker commissions. This applied to both new business and renewals. Again, just as a matter of complete transparency, this significantly impacted our revenues. And again, prior to this, some other carriers had announced that they weren't paying commissions on certain Medicare drug plans. We decided in 2025, right, we have to really step back and evaluate who we are and what we're doing and make sure that what we are doing is going to keep us in the community and in a place of being able to serve our clients. So this year we kind of brainstormed what are we going to do for 2026, and looking ahead, we said, well, we could work for free. Nobody was ecstatic about that. There's other free resources out there like ship counselors and Medicare.gov. Um, we could help with only plans that pay a commission, and that felt very disingenuous. Or we could push other products where we're commissioned. Again, didn't feel very pretty or nice. We could stop helping with Medicare Part D completely, which is unfortunately what a lot of our colleagues have done. We could develop a do it yourself Part D or a Part D membership club or some other nonprofit or other non licensed solution. And jokingly, I said, well, maybe we'll just come up with a Part D OnlyFans page. CMS wouldn't approve that. Just kidding. I didn't really present it to them. But looking at all of these options, right, and just being really thoughtful and considerate about what are we going to do? How are we going to do it? Here's what we decided we were going to do. Looking at Medicare Part D, standalone prescription drug plans, and Medicare Advantage Part C, um, we decided this was our best opportunity to help our clients learn how to do some of this themselves. And if you want, not if you want, you absolutely should want to call us to enroll in coverage so that you're not calling an 800 number every time you need something. But we're going to teach you how to do your own reviews. We have classroom time at the College of Lake County, currently November 8th, November 22nd, December 6th, 9 to noon. I'm going to be firming up those dates and times, but we'll teach you how to use Medicare.gov to to compare your plans. And then you can ask us, come back to the agency and say, hey, Carrie or Ruthie, I want you to enroll me in whatever plan, and we'll absolutely do it. The time consuming piece for us, again, in a matter of as a matter of transparency, was collecting the drug information, analyzing the plans, and meeting with folks to explain all of the nuances. But if we can do that on a group basis, it will help us help you, and we'll still be able to provide a high level of service, which is where our hearts are. We'll also have some written instructions that we're sharing in a video tutorial. And then we're really excited to introduce, we also have a Medicare Part D membership club through an affiliate. Medicare prohibits us, we're not allowed to be compensated for any part of Medicare Part D, but we did find an affiliate program that we're excited to present to you. And they will help with the detailed reviews for those clients who want somebody else to do the heavy lifting and to really explain the analysis. The cost will be $50 for up to 5 prescriptions and $100 for those with 6 or more prescriptions. And that's an annual cost. It's very, very competitive to what other fee-based services in the market are providing. And we're really proud to introduce that as an option for our clients. You'll get a complimentary analysis, recommendations, and then you can come back to us for enrollment. So for our Medicare Advantage folks, again, 30-minute review, business as usual. We're going to collect your updated list of doctors and prescriptions. We're going to work our magic and do an analysis and then share our results and recommendation. For anybody who's doing the Part D affiliate club, we will still be collecting the Medicare Part D updates, sending them over to the affiliate, and they will be then having the meeting with you, but we'll be sending them over the information that they need to really be effective and useful in your journey. As a reminder for our Medicare Advantage clients, if you don't recall, starting in 2024, CMS had the bright idea of making us record all of our phone appointments and reading a disclaimer. So unless you want one of these appointments recorded, like this webinar, and taking this much long reading disclaimers, we'd prefer you just come in the office. Well, obviously call us give us your updated list of doctors and drugs, let us do our analysis, and then come on in and see us. We'd love to see you and walk you through this, and then we don't have to do the recording. So, yeah, that's our plan for 2026 annual enrollment period. And I just want to say thanks again to our wonderful sponsors, and thank you, to our clients. Again, we're so grateful for you, and know that we're doing everything possible to balance our care, transparency, and sustainability while maintaining our personal touch. Our goal is to always live answer our phones, to respond with thoughtful and accurate information. And we had to make some adjustments to how we do that, but know that it was with you front and center in that decision the whole time. And just last but not least, your referrals and trust allow us to continue serving the community and to serving your friends. Thank you so much for those who are referring clients, and for those who have left us a Google review. If you have not, please do that. It significantly helps us with our search engine optimization, and also helps others find us and reinforces our reputation for care and integrity. So thank you again for being part of our Horizon Benefit Services family. If you're looking to leave us a review, you can just take your cell phone out, point the camera over this QR code, a link will pop up. It'll ask you to just, leave a brief review. You don't have to leave a dissertation, but a few comments would be really helpful. Again, our goal is to keep answering our phones live, supporting you personally, and making decisions that are guided by our shared values of honesty and service. So with that, we hope you have a great rest of your day, and we appreciate you. Bye-bye.